Weak ankles are a surprisingly common problem, affecting people of all ages and activity levels. But what exactly is ankle weakness? At its core, it signifies a reduced ability of the ankle joint and surrounding muscles to provide stability and support. This can manifest as a feeling of instability, a tendency to roll your ankle, or even pain during or after activity. Several factors can contribute to this weakness. Ankle sprains, often resulting from sudden twists or impacts, are a leading cause. However, a sedentary lifestyle where the ankle muscles are rarely challenged can also lead to atrophy and weakness. Improper footwear, especially shoes lacking adequate support or those with excessively high heels, places undue stress on the ankle, predisposing it to instability. Ignoring ankle weakness can lead to recurrent sprains, chronic pain, and even impact your ability to participate in everyday activities. Addressing it proactively is key to preventing further injury and maintaining mobility. Now that we understand what ankle weakness is, let's explore how to assess its severity. Several simple self-assessment tests can provide valuable insights. Start with a balance test. Stand on one leg for as long as possible, noting any wobbling or difficulty maintaining stability. Next, assess your range of motion by gently rotating your ankle in circles, both clockwise and counterclockwise, noting any stiffness or pain. Pay attention to any clicking, popping, or grinding sensations. These tests can help pinpoint specific areas of weakness or limitation. However, it's crucial to recognize when professional help is needed. If you experience persistent pain, significant instability that interferes with daily activities, or recurrent sprains, consult a doctor or physical therapist. They can provide a comprehensive evaluation and recommend a tailored treatment plan. Self-assessment is a good starting point, but professional guidance is essential for more complex cases. Before diving into strengthening exercises, remember the vital importance of warming up your ankles. Think of it as preparing the engine before a long drive. A proper warm-up increases blood flow to the muscles and ligaments, improving flexibility and reducing the risk of injury. Neglecting this step can lead to strains or even sprains, setting back your progress. Effective warm-up exercises include gentle ankle rotations, both clockwise and counterclockwise, for about 30 seconds in each direction. Another beneficial exercise is alphabet tracing. Use your big toe to trace the letters of the alphabet in the air, focusing on controlled movements. Finally, incorporate calf stretches, holding each stretch for 20 to 30 seconds. These simple warm-up routines will ensure your ankles are ready to handle the strengthening exercises to come. Now that your ankles are warmed up, let's move on to foundational strengthening exercises, starting with calf raises. This exercise targets the calf muscles, which play a crucial role in ankle stability. To perform a calf raise correctly, stand with your feet flat on the floor, shoulder-width apart. Slowly rise up onto the balls of your feet, engaging your calf muscles, and hold for a second at the top. Then, slowly lower back down. There are variations to increase the challenge. Straight leg calf raises primarily target the gastrocnemius muscle, while bent knee calf raises focus more on the soleus. Start with bodyweight calf raises, performing 2 to 3 sets of 10 to 15 repetitions. As you get stronger, you can progress by adding weight, such as holding dumbbells or using a calf raise machine. Proper form is paramount. Avoid bouncing or using momentum. Complementary to calf raises are heel raises, which strengthen the anterior tibialis muscle, located on the front of your shin. This muscle is essential for dorsiflexion, lifting the foot upwards, and plays a vital role in preventing ankle sprains. To perform a heel raise, stand with your feet flat on the floor. Slowly lift your toes off the ground, shifting your weight onto your heels. Hold this position for a second or two, engaging the anterior tibialis, and then slowly lower your toes back down. Aim for 2 to 3 sets of 10 to 15 repetitions. A common mistake is to perform the movement too quickly or to use momentum. Focus on controlled movements, feeling the muscle working. Another mistake is to lean back excessively, which reduces the effectiveness of the exercise. Maintain an upright posture throughout the exercise. While heel raises indirectly engage the tibialis anterior, toe raises provide a more direct focus. This exercise further strengthens the muscle responsible for lifting the foot upwards, improving ankle stability and control. To perform toe raises, sit in a chair with your feet flat on the floor. Keeping your heels firmly planted, lift only your toes as high as comfortably possible. Hold this position for a second or two, feeling the contraction in the front of your shin, and then slowly lower your toes back down. Aim for 2 to 3 sets of 15 to 20 repetitions. Integrating toe raises into your routine is simple. They can be performed almost anywhere, even while working at a desk. Consistency is key. Make toe raises a regular part of your ankle strengthening program for optimal results. Remember to listen to your body and stop if you experience any pain. Beyond strengthening individual muscles, improving balance and proprioception, your body's awareness of its position in space is vital for ankle stability. The single leg stance is an excellent exercise for this. Start by standing on one leg with your eyes open, focusing on a fixed point in front of you to maintain balance. Hold this position for as long as you can, aiming for 30 seconds to a minute. Once you can comfortably hold the single leg stance with your eyes open, progress to closing your eyes. This removes visual input and forces your ankle muscles to work harder to maintain balance. Further variations include standing on an uneven surface, such as a pillow or folded towel, and incorporating arm movements, such as reaching or circling your arms. These exercises challenge your balance system and improve ankle stability in dynamic situations. For a more advanced challenge to your balance and proprioception, consider incorporating a wobble board or balance board. These tools create an unstable surface, forcing your ankle muscles to constantly adjust and maintain equilibrium. When first using a wobble board, start with both feet on the board, focusing on keeping it level and preventing it from touching the ground. Use a wall or chair for support if needed. As you become more comfortable, progress to standing on one foot on the board. Again, focus on maintaining balance and preventing the board from touching the ground. Start with short intervals of 30 seconds and gradually increase the duration as your balance improves. Wobble board training effectively enhances ankle stability and reduces the risk of sprains by improving your body's ability to react to uneven surfaces. Always prioritize safety and start slowly. Maintaining a full range of motion in your ankles is just as important as strengthening them. Restricted range of motion can limit mobility and increase the risk of injury. Ankle circles and alphabet tracing are excellent exercises to improve and maintain flexibility. For ankle circles, sit or lie down with your leg extended. Slowly rotate your ankle in a circular motion, first clockwise and then counterclockwise, for about 30 seconds in each direction. Focus on smooth, controlled movements. For alphabet tracing, use your big toe as a pen and trace the letters of the alphabet in the air. These exercises should be performed daily. Integrating them into your routine is easy. Do them while watching TV or during breaks at work. Prioritize proper technique over speed, and stop if you experience any pain. Beyond exercises, proper footwear plays a significant role in ankle health. The shoes you wear daily can either support or hinder your efforts to strengthen weak ankles. Opt for shoes that provide good arch support, a firm heel counter, the back part of the shoe that cups your heel, and adequate cushioning. These features help stabilize the ankle and reduce stress on the joint. Avoid high heels as much as possible as they force the ankle into an unstable position and increase the risk of sprains. Similarly, overly flexible shoes, such as some minimalist running shoes, may not provide enough support for individuals with weak ankles. Choose appropriate footwear for your activities. Supportive athletic shoes are ideal for exercise, while comfortable and supportive shoes should be worn for daily activities. Stretching is an often overlooked, yet essential component of ankle health. Tight calf muscles and a restricted Achilles tendon can significantly contribute to ankle instability and increase the risk of injuries like Achilles tendonitis. Regularly stretching these areas can improve flexibility, reduce stress on the ankle joint, and enhance overall mobility. Focus on 2 key stretches. Calf stretches targeting both the gastrocnemius, straight leg, and soleus, bent knee, muscles, and Achilles tendon stretches. To perform a calf stretch, lean against a wall with One leg straight behind you and the other leg bent in front. Hold for 20 to 30 seconds. For an Achilles tendon stretch, perform the same stretch but with a slight bend in the back knee. Hold each stretch for 20 to 30 seconds and repeat several times a day. As your ankle strength improves, it's crucial to progressively increase the intensity and duration of your exercises. This principle, known as progressive overload, is essential for continued progress. Start by increasing the number of repetitions or sets you perform. Once you can comfortably perform the exercises with good form, consider adding weight or resistance. However, it's equally important to avoid overtraining. Pushing yourself too hard, too soon can lead to injuries and setbacks. Listen to your body and pay attention to any signs of fatigue or pain. Rest and recovery are just as important as exercise. Allow your muscles adequate time to recover between workouts. If you experience persistent pain, reduce the intensity or duration of your exercises or consult with a healthcare professional. One of the most important principles in any exercise program, especially when dealing with weak ankles, is to listen to your body. There's a difference between the normal discomfort of working your muscles and the sharp, persistent pain that signals an injury. Discomfort is usually a mild ache or burning sensation that subsides shortly after exercise. Pain, on the other hand, is often sharp, localized, and may linger or worsen after exercise. If you experience pain, stop the exercise immediately. Rest and allow your ankle to recover. If the pain persists for more than a few days, consult with a healthcare professional. Ignoring pain can lead to more serious injuries and setbacks in your progress. Knowing when to push yourself and when to back off is crucial for safe and effective ankle strengthening. Consistency is the cornerstone of any successful exercise program, and ankle strengthening is no exception. Performing exercises sporadically will yield minimal results to achieve long-term benefits. Make ankle strengthening a regular part of your routine. Aim for at least 3 to 4 sessions per week, incorporating a variety of exercises that target different muscle groups and aspects of ankle stability. Find ways to integrate ankle exercises into your daily life. Do calf raises while brushing your teeth or practice single leg stance while waiting in line. Set reminders on your phone or calendar to ensure you don't skip your workouts. Over time, these exercises will become a habit, leading to stronger, more stable ankles and a reduced risk of injury. While strengthening your ankles is crucial, proactive injury prevention is equally important. Be mindful of your surroundings, especially when walking or running on uneven terrain. Scan the path ahead for potential hazards like potholes, rocks, or slippery surfaces. When possible, choose even surfaces to minimize the risk of ankle sprains. Consider using ankle supports, such as braces or sleeves, during high-impact activities like running, jumping, or playing sports. These supports provide extra stability and can help prevent injuries, especially if you have a history of ankle sprains. However, don't rely on ankle supports as a substitute for proper strengthening and conditioning. They should be used as a supplement, not a replacement, for a comprehensive ankle health program. If you're dealing with specific foot or ankle conditions like plantar fasciitis or Achilles tendonitis, it's essential to modify your ankle strengthening program accordingly. Plantar fasciitis, characterized by heel pain, may be aggravated by exercises that put excessive stress on the plantar fascia. Avoid high-impact activities like jumping or running, and focus on gentle stretching and strengthening exercises. Achilles tendonitis, inflammation of the Achilles tendon, requires a different approach. Avoid exercises that excessively load the tendon, such as plyometrics or uphill running. Instead, focus on eccentric calf raises, lowering the heel slowly, and gentle stretching. Consult with a healthcare professional or physical therapist for personalized recommendations and to ensure you're performing exercises safely and effectively. They can guide you on modifications and exercises to avoid based on your specific condition. To truly make ankle strengthening a sustainable habit, look for opportunities to integrate exercises into your daily life. This approach eliminates the need for dedicated workout sessions and allows you to consistently strengthen your ankles throughout the day. For example, perform calf raises while brushing your teeth, washing dishes, or waiting for the kettle to boil. Practice single-leg stance while waiting in line at the grocery store or while talking on the phone. Do toe raises while sitting at your desk or watching television. These mini-workouts may seem insignificant on their own, but they add up over time and can significantly contribute to ankle strength and stability. Get creative and find ways to incorporate ankle exercises into your existing routines. An ankle strengthening program isn't a one-size-fits-all solution. It requires ongoing monitoring and adjustments to ensure it remains effective. Regularly reassess your ankle strength and stability using the self-assessment tests we discussed earlier. Are you able to balance on one leg for longer periods? Is your range of motion improving? Based on your progress, adjust your exercise program accordingly. If you're no longer challenged by certain exercises, increase the intensity, duration, or resistance. If you're experiencing pain or setbacks, reduce the intensity, or switch to easier exercises. This dynamic approach ensures that your ankle strengthening program remains tailored to your individual needs and helps you achieve optimal results. While self-care and consistent exercise can significantly improve ankle strength, there are times when professional help is necessary. Recognizing the signs that warrant a visit to a doctor or physical therapist is crucial for preventing long-term complications. Seek professional help if you experience persistent ankle pain that doesn't improve with rest, significant instability that interferes with your daily activities, or recurring ankle sprains despite following a strengthening program. A healthcare professional can properly diagnose the underlying cause of your ankle weakness and recommend a tailored treatment plan. They may also identify other contributing factors, such as nerve damage or structural abnormalities, that require specific interventions. Don't hesitate to seek professional help if you're concerned about your ankle health. In conclusion, strengthening weak ankles safely involves a multifaceted approach. We've covered everything from understanding the causes of ankle weakness and performing self-assessment tests to implementing effective exercises, incorporating proper footwear, and prioritizing injury prevention. Remember the importance of warming up, progressing gradually, listening to your body, and staying consistent. Taking a proactive approach to ankle health is crucial for overall well-being and injury prevention. Strong, stable ankles not only improve your athletic performance but also enhance your ability to perform everyday activities with confidence and comfort. Don't underestimate the power of consistent effort and mindful practices in achieving long-term ankle health. Start today, and your ankles will thank you for years to come.